Hi, good evening, everyone, and good afternoon to Professor Friebe from Europe. So we have with us today one of the speaker who has different varieties of expertise. He's not just an academician, he's also an innovator, entrepreneur, and works with a lot of startups, and many innovative products, that's what I would say. So let me read a little bit about him. Micheal Friebe has been involved in diagnostic imaging and image-guided therapeutic products and services, as well as other related medical technologies ventures. As founder, innovator, CEO, investor, he previously was the founder and CEO of Tomovation plus Alliance Medical Northern and Central Europe. Alliance bought Tomvation in 2008, both radiology services equipment. And prior to that, with Neuromed AG, Dr. Friebe currently is a board member of startups and R&D companies. He works on intraoperative SPECT systems, volumetric ultrasound, and a shareholder of several startups, as well as investment partner of medical technology startup fund. He was board member of 3 publicly traded medical technologies companies in the US and currently sits on the board of multiple companies. He's regular speaker, listed as an inventor in more than 50 patent applications, has written well over 60 articles, multiple books, which he shared one of it with us right away. And he's a member of IEEE, ISMRM, RSNA, and ECR, and an affiliated professor with the chair of computer-aided medical procedures at Technical University Munich, one of the best biomedical engineering in Germany. And in December, he's also a full professor in TUM at Otto von Guericke University, Magdeburg, Germany. So the one small story before I leave him to talk and take over is how I met Micheal Friebe. Is that he was a professor of one of my student, Yashashwini. Long back, she was in the first autonomous batch from 2008 to 12. So she actually went for her master's in Munich, and that's when she met Professor Friebe. Since then, we have been interacting into multiple things, and also we hosted Micheal Friebe in our college a few years back. I mean, in 2018, I believe, and we had a 1-week amazing workshop, which we still revive a lot of memories of that. And after that, we have been talking a lot on virtual and many other things. With this small intro, I know I'm not sure if it was recent resume, but that's what I found from the university website. But there are a lot of other things you might have achieved post that. So I leave the stage to you to take it forward. Thanks, Professor, for agreeing to talk to us.
Thanks a lot, Abhishek, for the introduction. And I really I also recall the time in Bangalore as very interesting. I had my son with me. He's here with me this week again. He's also almost finishing up his studies. You have not really, what you have provided as information is not completely up to date, but it's really not that important. I am right now spending my time traveling between Poland, where I have a research professorship in Krakow. By the way, if anybody wants to ever come to Poland, it is a wonderful place. And it's probably, and I've seen lots of cities in this world, it's one of the most beautiful towns I've ever seen. And there's actually, interesting enough, a lot of Indians there as well. So I think there's some exchange programs that go for that. Anyway, I am not really, and I think I should start with this, I'm not really a deep tech research professor. What I am, and what my ambitions and enthusiasm is to stimulate students like you to actually think about innovation generation. Think about how can we actually not only make things a little better, but how can we actually come up with things that help solve big issues and big problems and address challenges that are around, and particularly challenges that are around in the healthcare setup. And I think if you really look at the Indian setup, you very, very easily will recognize that there are some issues that may not be around in Europe or the US or in Africa. They are very specific to India. And for that, I believe you are the ones who can solve those problems. And the German, Abhishek didn't say that, but I'm from Germany. So I'm a German guy, and the German is not the one who solves the Indian problems. It's the Indian who solves the Indian problems. And that's why you need to, be very empathetic what's going on in your surrounding. And you also need to understand of how innovation can actually be developed and how the innovation can actually be detected, how it can be explored. And I use, you may remember that, Abhishek, but I used a definition for innovation. I don't have it on the chart, but my definition of innovation is invention multiplied with commercialization. What that means is, I have about 100 patents. So the 50, it was a long time ago that you mentioned, I have about 100 patents. And at the end of the day, a patent or a technology is an invention. But if nobody uses that invention, it's of no use. It's basically just a piece of paper. It's an invention, right? And it may never really do anything. It may never really solve a problem. It may never really address a challenge. So you need to find that bridge from the invention to actually making it available to patients, in that case, to doctors, to hospitals, or maybe to really address health issues that may not even be addressed at the moment. And to bridge that, to really get to that point, that's actually generating innovation. One other example I quite often use is like, what is innovative about is a car with 5 wheels innovative? And previously to that, I've asked the question, what is innovation anyway? And most of the time, the answer is, it is something new, it is something unique, but very, very rarely the question comes, somebody actually needs it or somebody uses this. And if you really think about how often the word innovation is used in your environment, Abhishek, you're very innovative. Or this is an innovative approach. Or this is an innovative product. What does it really mean? And anyway, going back to my 5th wheel in the car, it is new. It is something novel. It is something that nobody else has, but is it really useful? Is it really something that solves a problem? And I would say the answer is no to that. Just adds cost and complexity. So having said all this, let me start with my presentation. And let me share my screen. I am sure you'll see it now, right? All there? Abhishek, can you thumbs up?
Yes, we can see.
Okay, very good. So what I want to do today is I want to, go a little bit into the health innovator's dilemma, and I want to explain what that is. But I also want to give you some solution ideas of some ways and some methods of actually, addressing these issues and actually dealing with the problem. So I want to give you some tools on your hand. And I personally believe that healthcare, and you guys are in a healthcare program, has to move away from the current way of treating sick people to more like a approach where you prevent sickness from happening. So we call the first part, the healthcare as we have it today, a fee per service model. So the doctor makes money when you go to them, right? When you're sick. And then you pay the doctor or the hospital or whoever. So you basically pay for being sick. That's not a really good approach. And it probably, particularly in systems where you don't have a proper health insurance, it will prevent people from going to the doctor because it costs them money every time they show up there. So the approach of actually, trying to reduce the health part and replace it with prevention and prediction and actually making sure that things are being detected beforehand could save a lot of money, save a lot of trouble. I mean, that's easily said, but as that innovator's dilemma already indicates, it is not that easy to actually get that done. So I'm starting off with this one. What you see up there on the top left is the United Nations Sustainable Development Goals. You may have heard about them, SDGs. There's 17 of them. And the 3rd Sustainable Development Goal of the United Nations says, everyone on this planet, everyone, not just the Germans or not just the Americans or not just some people in India, everyone should have good health and good well-being, and it should be accessible to them. It should have equal access, it should be affordable, and it should be there. Well, think about your own country. How many people in rural India do have proper access, affordable access, equal access to health and well-being? And think about maybe Africa, and think about what's going on there. So it is certainly, there's a lot of issues to be addressed with this. What we should do is go on, and I'm giving you later on a fifth P even. That's called right now the 4P medicine. There's a guy called Professor Leroy Hood who actually came up with that concept. And basically what it says is, if we would be able to predict certain things from happening in your body, we would be able to prevent diseases from happening. But what we need to do is we need to personalize these monitoring, health, prevention, prediction approaches to the individual. It's also something we call precision medicine, because medicine at the moment is very, very much statistics. If you're 50 male, you will be put in a certain category, and that's kind of like the average of this 50 male one will be, that's how you will be treated. But individual components will not necessarily be taken into consideration. And that's that last P on this 4P. We need to make sure that everybody on this call, everybody on this planet knows or understands that healthcare and good health is not coming from only having a good healthcare system, but it comes from many other aspects. Good food, exercise, no drugs, environmental concerns, etc., etc. These are, what we label under participation. Every individual needs to be interested in their own health and needs to make sure that all these determinants are properly working. Another thing we should do, and I'm speaking now as to you as an innovator, inventor, what you need to do is you need to, when you develop new medical devices, products that are used either with healthy people that are not sick yet, for monitoring or for prevention, or for later stages when people have developed something and that should be treated. There's 4 premises that you should actually work on. You should obviously always try to make the new healthcare in the future better than the old one. I think that's a pretty given one, right? But you should also improve the experience of the patient and the clinician in their own setup. We had with COVID a lot of issues with experience. I mean, the healthcare workers were overworked. There were not many of them. They were not appreciated necessarily, were not paid very well. They had to do too many administration issues and not dealing with the patient. There was a lot of issues involved. And that's why we also developed the problem right now that people don't want to go into healthcare anymore. Maybe different in India. I'm not entirely sure how the situation is there, but in Europe, we have huge issues with healthcare staff. And the other thing that people always forget, don't make things more complicated. Don't make them more expensive. Try to actually make them cheaper. And cheaper to me is the most important value proposition in development. If you make a product 10 times cheaper than it is right now, you make it available to everyone. If you have an MRI system that you make better, that may be good for some few people that can afford that, but it will not help everybody to get access to it. It only happens if the products or services are dramatically cheaper than they are right now. And like new technologies that we have coming up right now, artificial intelligence, cheap advanced sensorics, all the deep learning aspects, they will actually probably dramatically reduce healthcare costs, I hope at least. And that will possibly lead to a shift from this fee-for-service model to a proper prevention prediction model. This is the dilemma that we're facing right now. We are not getting people actually focusing on these things because there is no business model behind it. Another thing, and that's the last one, if you do all these things together, you need to still think about sustainability in health. And sustainability is an important aspect. Globally, 7% of the CO2 emissions are somehow related to healthcare provision. That's a lot of stuff. And that has also to do with having expensive, complicated, resource inefficient products available, be inefficient in general. And that's a huge issue. So if we again move more towards preventing the diseases, we would even save some CO2. And let's face it, our human health is dependent on the health of the planet, the health of our environment. So even if you are able to improve health in general, it will not necessarily help us so much if we at the same time destroy our planet. So I'm saying that also because you are young people, make sure that the environment, the health of the planet is of essential urgency to you. Nothing will, whatever we do in this on this planet, and if we destroy the planet at the same time the next 50 years, nothing will have an effect. So please also, and then that's a little bit pointing towards like China as well and India, try to make everything possible to reduce, reduce making this planet a worse place than it is right now. Let me just go back to this one very quickly. Cost, and I mentioned it before, is for me the most important value proposition. It's not from a technical or from a research point of view that people want to do make things better and cooler. Very little they put into reducing cost as a research effort, but I think that is what really, really drives innovation, and that would really is the thing that would cause a disruption. And disruption, I'll talk about what that is in a second. So the question is, in all of us, and then I'm including myself on this one, so I'm not pointing fingers at you and saying you're not doing it. We are also not doing it. Are we really working on this preventive medicine approach? Are we really working on cost reduction? Are we working really on, making sure that the planet stays healthy? And I have to say, unfortunately, not. And one of the reasons is that we value profit significantly higher than anything else, and that needs to change. Because if we don't change that, there will be a disaster coming up soon. So I believe, and that's a little bit of a summary on what I just said, so I can jump over to the next one. We need to move away from diagnosing and treating diseases in case of sickness. I'm not saying we shouldn't do that anymore, but that's the exclusive focus right now in healthcare provision. The focus is not on prevention, and we need to put that into the future. And we need to add like precision elements, so the personalized elements, and we need to put some more patient-centric medicine in there. All very easy said. I know that it's nice to put this on a screen and then just say we need to do it, but then there always needs to be efforts of individuals behind it, and there always needs to be a business model behind it. And so very important also as a message to you, engineering sciences are cool and they will solve possibly some problems, but you need to have some understanding of business and innovation models. That's your responsibility as engineers as well, because only if you develop something that is actually used and useful, you will actually be able to change something. So that business models are important, and it's important to understand some of the business aspects to that. And again, that's my summary on that first part here of the talk. Focus on cost. Very, very innovative. If you are able to reduce cost by a factor of 10, you cannot use what is existing right now. You have to change basically with a completely new approach. And just to illustrate that one more time, is if you really would address, look on the left side, risk and behaviors, if we would be able to address these risk and behaviors that we have there, reduce stress, make sure that people sleep enough and have a good quality sleep, reduce drug abuse, smoking, alcohol, and all these things, make people move a little more, improve their diet, we would be able to dramatically reduce the chronic conditions that to a large extent depend or come from these risk behaviors. Diabetes, that's not moving, poor diet. Coronary artery disease, also mainly diet. Congestive heart failure, etc. Back pain is not moving, or maybe having the wrong type of work, etc., etc. All these have a root cause in the left side. And if we now be able to address these chronic conditions, we could actually save 80% of the total cost that are related to chronic illnesses. And the chronic illnesses are the most expensive thing to deal with in healthcare. So you see that already on this chart. If we move things back to the left, so we don't treat anymore the results, but we go to the root cause problems on the left side, we could make life of quality better, clinic experience better, and we would save significantly cost in the healthcare system that we could invest somewhere else, maybe in prediction. Already a sign of how a business model could change. Now, this is an interesting chart. It's called life. Well, it's basically life expectancy with cost compared. Not surprisingly, the US is on the top. But if you see, they are on the top of the cost, but they're not on the top of the life expectancy. There's other countries like Singapore, Chile. They're very interesting ones. Germany is not that good either, but better than the US and significantly cheaper than the US. What you see here is cost does not necessarily have something to do with life expectancy. Interesting enough, though, and I think what we need to do is we need to learn from these countries that are highlighted here, and we need to learn what is different there than is in the United States. To a large extent, we actually know why the US is that way, because the profit part is all the way on the top, and not everybody can afford healthcare anymore, and so a lot of people have to drop out, and that reduces the average life expectancy. People that do have money in the US still have the same life expectancy and then in the other industrialized nations, but the average is going down because a lot of people cannot afford healthcare anymore. So the question is, how do we detach healthcare provision from the luxury aspect or from their high cost aspect? How do we make it affordable? Very, very important issue. So cost goes up, affordability goes down. At the same time, longevity goes down. Actually, well, longevity goes up in this case. If you in general it went up, but it will go down when the affordability will go down. I put a very big question mark in there in healthy longevity. So longevity is how long do you live? Healthy longevity means how long do you live healthy? And what happened, and that's unfortunately statistics, and please listen to this carefully, longevity has increased, but the time it takes to die has also increased, which means you have actually been sick for a long time, even though you lived longer. Is that something that we should thrive for? I mean, just getting longevity up, we should get healthy longevity up. And for that, we need to make sure, I think comes later, a little bit later on, we need to make sure that the lifespan equals the health span. So not turning out to be 100 at some point in time and being sick for 20 years before that, but actually being healthy for 99 years and maybe have a short disease and then that's over, right? This is health adjusted life expectancy. That's something that is actually very important. Anyway, what happens right now with this is unequal access we have. I think we mentioned this in the beginning already. Staff shortages, well, COVID-19 did not help there. We're not addressing the root cause problems. Remember that left part on that chart beforehand. And we need to move away from the fee per service to a more personalized precision participation. That's what I call the innovator's dilemma to a certain extent. We are right now developing only little incremental solutions. We make an MRI a little better. We make a CT a little faster. We make everything a little better. This little better is not really changing, and it causes just more, it results in more cost, maybe in a higher longevity, but not in a higher quality of the healthcare system. And why are we not investing in something else, in prevention and prediction? Because nobody pays for that in that system right now. And that's the dilemma that we know we should move to: prevention, prediction, participation, personalization. But there is no business model for that. And if there's no business model, nobody pays for the development. If there's no business model for that, you will not get reimbursed for innovation or for your invention that you try to get into the market. And then maybe it's not even a market because nobody is paying for it. So think about how you can actually change that setup, and maybe you can change it locally in India. And I do believe personally that countries like India and your neighboring countries, they will be the driving force of health innovation in the future. It will not be the US and it will not be Europe, because we are too stuck in our systems at the moment. So this is a complicated chart. I'm not going to go through this. Abhishek, you have to just know me if you want to have the chart, the slides. I'll obviously can give them to you. The most important thing on this one is that the quality of healthcare provision only accounts for 15% of why you are staying healthy or not. So Abhishek said thumbs up. So I'm going to drop the slides later on. I probably cannot drop them in the chat box, but I'll make them available and Abhishek can distribute them. So look at the unresolved health issues here. This is what you should address, and that's what I'm trying to get into you as potential innovators. Address the unresolved health challenges. Don't necessarily make an MRI. I'm putting on this too much, but I'm an MRI physicist. That's why I grew up with, and I love MRI systems. But MRI systems will not change these health problems. And a faster MRI will also not change anything. It will just make diagnostic a little better. That doesn't even need to be better because it doesn't really do anything for the patient's therapy outcome. So you always have to ask yourself, is that important what I'm doing, and is it solving some of these challenges? And now I just wanted to give a quick start on disruption, and then I'm going to jump over into giving you some methodology on how to approach this. So we talked about innovation before. Most people say it's doing the same things, but a little better. But what is disruption? And disruption is something, actually, if you put this down, is in essence, the word means to interrupt, and to interrupt by, just doing something that disturbs the existing market. And what you want to do is you want to do this intentionally, because you know that there is a problem that needs to be addressed. And you want to do this product, this solution to this problem with a big bang to a certain extent, and doing it completely different than has been done before, and particularly doing it dramatically, significantly cheaper, because only through the cost issue you can address new markets and you can open up opportunities for others to actually get into this segment. Intent I discussed. So in essence, if you want to move from an innovation into a disruption, you need to make things that make the old things obsolete, that make the old processes obsolete, that make the old products obsolete, that make the old workflows obsolete. Basically, whatever you have done right now, challenge it and try to disrupt it intentionally. I know this is not perfect. I think I can actually make this much better than it is, much cheaper than it is, much more efficient than it is, not 10%, 10 times more efficient, 100 times more efficient, 10 times cheaper. And then you will actually come up with something that disrupts that market. So disruption, to summarize that, is intentional intervention with a new product and an intentional replacement of an existing system process. And now going to healthcare, and and going to my dilemma that I initially said, it is very difficult to change any system that is kind of like stuck, and you have been working in that for 60 years. When you're sick, you go to a doctor. When your doctor says you have to go to a hospital, you'll be treated. It has always to do with your health, with being sick, not staying healthy. So if you want to shift that to the health moment, it is probably not possible to do that in that existing system, because there's too many people who don't like change. Do you think the doctor would like not having as many patients anymore? Patients pay him, remember? By the way, every time I say him, I mean him and her. So I'm sorry for that, but it's a little bit used to my language. So every time you do that, a patient will disappear from the doctor's income. Do you think the doctor will like that? Likely not. If you have less patients ending up in a hospital, do you think the hospital will like that? Absolutely not. Do you think it will be cool for the pharmacist if less people come to the pharmacy to require pharmaceuticals? Definitely not. So this system that we like to have as patients or individuals is not the system that the healthcare professionals like, because that's not what they're used to dealing with, and that's not their business model. What I'm trying to say is you need to change the existing system by replacing it with a new one. And that's not often not happening by just doing little incremental little side steps, but you need to be a little bit more dramatic. So is the disruption what I just described, is that an oxymoron? People don't know that word oxymoron. Is basically something that can't happen. It's a terminology. It's like if you put health innovation and disruption together, it's that never will work. And I do believe that is to a certain extent true, but if we think it a little further through, then you may actually come up with little side ideas of why that would still work, this disruption in the healthcare system. So first of all, you need to understand who wants the disruption in the health delivery system. Well, guess who? Every one of us wants that, because every one of us, to a certain extent, is not happy with the situation that we have to wait in a doctor's office, that we are kind of like treated not very personal, that is too expensive. We like this, we would like this, and we would like to live healthier and longer at the same time. So is that possible in the current setup? Probably not. In what business model is it possible? I believe that whenever we start making clear that prevention, prediction, participation, personalization, and subsequently prolonged health will actually be, there will be a value associated to that, we will develop a business model. So economics has a huge effect on determining what kind of things will be developed. And as soon as we see that prevention will actually cause a reduction in cost, it will be beneficial to everyone and will invest into this segment. So I guess that every one of us is in agreement that we need to change that current system. And then we will actually probably need to start this transformation process. And I believe that digital technologies and components with a focus on prevention are the only solution and the only way that we reach disruption in that segment. So what I would do right now is, if I'd be in your age, I would invest in digital health, in monitoring, in data analysis, in prediction models, and at the end of the day, make everybody aware of the fact that if you use these kind of tools from early age on, we put genetic information in there, with all kinds of other things in there, that would lead to prevention and to a much better health. And I want to emphasize it one more time. If we continue to do killing the planet at the same time, it will not help us subsequently. So think about something we call the One Health and planetary health concept. I've written an article on this one where you basically see that everything is connected. So the human health is connected to the plant health, is connected to the veterinary health, to the environmental health. And only if we get this under control, we'll actually have a setup where environmental issues are less of a problem to the individual's health. Okay, so what we need to get done is we need to do this 4-5P approach. We need to do frugal innovation. Frugal innovation is what I said before, is we need to focus on cost, make it really cheap. We need to do something where we invest time, money, efforts into getting products out there that are available to everyone. That's what we call healthcare democratization. Make it available, accessible to everyone. And then we will have huge paybacks. And these are not only in terms of money, but in terms of life quality, in terms of healthy aging. And that I believe is incredibly stimulating for you as an innovator as well. So what we do have as a difficulty at the same time, countries like Germany, we spend way too much. And what that shows is that countries that are not in the same economic level believe that is what they should go for. So just being very picky and focusing on this call right now. In India, people would like to have the same healthcare than in Germany or in the US. Why? Is that so good? Can you not do something differently? Do you have to have the same 3 Tesla MRIs that really don't do anything? Focus on the problems you have in your state, and we from the high income nations cannot solve that. So I think you have different issues and you have different ways of addressing these problems. And maybe you have even different business models that would help you, getting that transformation done faster. I firmly believe in that. That's why I also said before, I believe that the innovation and the change from this current healthcare system to that new healthcare system will come from countries like India, not from Germany. So I think, and that's now I'm getting to the innovation methodologies, is don't think small, think big. So think in terms of what is your big vision of when you want to develop, what is the cool thing you want to do? And then try to find some incremental steps of how to reach that vision. But if you start with an increment, you will have an increment, you will add another increment, another little bit, you will never reach a big goal. Have a big goal. And I think some of you, maybe most of you, and that does not only go for India again, it goes for most of the people in the world, they think way too little and way too incremental. So be big thinkers. And then we may have to actually change our approach. And that's why I have this positive impact pyramid on the left. a good friend, Francisco Palau, who's also the main guy behind this innovation model that you see in the center, has come up with, and there's so many P's always. You remember the 4 P's in healthcare or the 5 P's in healthcare, and there's also 5 P's here in this positive impact pyramid. You need to have a purpose, and that's your big vision. That's your big goal, and that's what when we address these big healthcare challenges. Say, I want to eliminate or eradicate cancer. I don't want to have anybody in India have no access to healthcare. That's a big purpose, a big goal. You have to consider while you're doing this, do not destroy the the planet. Take the people with you. Don't treat them like crap. Involve them. Obviously, you need to have some form of business model, some form of profit, because if you don't have profit, you cannot sustain the operation. And to get that done, you need to have a product. But you don't think like a lot of the very capitalistic countries, I don't want to name them in particular, but you saw them on the list of life expectancy and cost all the way on the top in the middle. Don't pack profit on the top of it. Be purpose-driven and not profit-driven. Now I'm getting to the methodology that I want to discuss a little bit more in depth. It's called the Purpose Launchpad. And the Purpose Launchpad starts, I think that's the first word on it, have a purpose, have this big goal. Have something that drives you and drives everybody in maybe your little setup at the university. Have a purpose defined. Obviously work in a proper team, have proper people around you, also investors or collaborators around you. Try to understand your customer. I'm going now clockwise, right? You see that? Understand your customer. Try to connect to exponential technologies, because technologies will be the way of actually making the offering cheaper and more available. So that's what we call abundance. Have a business model. That's the thing we call viability. Have certain processes where you measure innovation abilities, measure improvements. If you have a process in place, you define a product with that, and you have the metrics where you measure results, kind of like a dashboard. And now you see when you look at this methodology, you see these 3 different colors. And the yellow color is what we call an exploration phase. It's kind of like, and that's typically what we do in the university. We would start with like, oh, I have an idea, or I have an issue. You start actually diving into this problem in the exploration phase. You go through this whole process one time, and there's for every one of these segments that are mentioned, these purpose, people, customer, there's different tools you can use. And once you are actually advancing to a certain extent and you have explored that phase, you try to validate it. You try to validate, is that actually true what I'm saying? Is that actually the assumption that I have, is that correct? That's the blue phase. And then you actually get into that purple phase. That is the impact generation or implementation phase. So that's when you have your startup. That's when you actually turning over from an idea into the real patient. And if you combine these with these, and you focus directly on these 5 P models, this prolonged health, that's the one I added, the 5th P medicine, I think you have a purpose-driven innovation model for healthcare. So this is my 5P model. You can use this anytime. It's co-registered and it's freely available. So that logo, I just love it. Of course, it comes from me, so that's why I love it. So don't take that too personal, but please, use it as a stimulation part for innovations to be generated in the healthcare domain. So I think I'll talked about this before, so that's I don't want to get over that too intensively. You'll get the slides anyway, so let me focus a little bit more on the solution ideas. So what I believe we need to get done is every one of us individually needs to be able to obtain their own health data, manage their own health data, use the data that is generated from normal living. I mean, I have this Aura ring. I don't know if anybody uses this, collects my data all the time. I sleep data, walking data, heart rates, breathing rhythm, many more. Temperature it measures. Take this data and actually, probably use some tools available that tell you what's going on with you and tell you particularly what might happen in the future. Now, if there's a variation in your heart rate from one day to another, it probably doesn't say anything. But if you see that there is an increase in your heart rate over a month, a very slow increase, but it's a straight line up, that is something you will never feel yourself, but the system can show you that there's something going on in your body that is not normal. In a normal setup, you would wait till you have really a heart problem and you go to the doctor. But if you measure it continuously and you take these data points, you may be able to find things much earlier than before. I think that's an advice to places like India. I'm not saying that you are a low-income nation, so don't get me wrong. I'm not trying to offend anybody here, but it's lower than Germany or the US. But don't try for what we believe is cool in the high-income nations. I think you can do much better in your own setup because you may have much less hurdles from a business model as well. So I believe in something called reverse innovation. Reverse innovation means why are you not the ones innovating? And then we bring it back to the high-income nations. Prevention as a focus, and maybe also think about how we can think about education, get everybody involved in this whole thing. And maybe the government needs to get involved as well. So I don't know. And we need to think significantly more exponential and disruptive, because I think exponential technologies and disruption, cost reduction is one of the topics, frugal innovation, they will actually help you develop really cool products. So with that, I want to go over and just go quickly into this exponential medicine topic, because I think that is something we have to think more in the future, and despite the fact that there may not be a business model available. And you may actually, also rethink on whether current setups in companies that are doing value capture is the right model. 99% of the companies that you will see in India and in Germany and the US are trying to actually squeeze everything out of an existing business model, rather than in thinking of investing in how can we actually have a future-proof model with innovation that helps everybody and has a big purpose. So using that, I think technologies will be a driving factor for that, because technologies will become cheap, widely available. They will be abundant, and they will be usable by everybody, and they will not be limited to high-income nations. Everybody will have access to them. So there's on the left side, there's these 30 technologies that will happen, that will probably be driving in the next decade. On that chart, you see what these technologies will actually possibly do with healthcare. They will introduce new medical devices, new drugs will be available. But what I think is the most important thing is what will happen if these things will converge these technologies. So not only using artificial intelligence, but using artificial intelligence with robotics, using it in combination with sensorics, using it in combination with genetic information, with synthetic biology. So having these different technologies work together, they are fast individually, and they may be significantly faster and more impactful if you combine them. And that's when there's a lot of these new domains developing that most of us know from the wording, but don't know exactly what they mean. And I have actually put together, you probably cannot read this, I apologize a little bit for this one, but I put in another book I wrote, I put together an analysis of what are the cost reduction opportunities for certain technologies and what are the disruption opportunities. And interesting enough, they almost always match. There's a couple of technologies where it doesn't match. So one more time, an indication that focusing on cost reduction, democratization will at the same time have disruptive elements. So one of the tools that we use for that is a so-called exocanvas. I don't want to go into detail on this one. There's what we call internal attributes and external attributes. The external attributes are more like on the left side, staff on demand, community. The other ones on the right side. You can read in that book I sent you, there's a little bit of an explanation on this one, so read a little bit to that. But if you use these kind of tools that are also implemented in this Purpose Launchpad, you will be able to actually drive or create an abundant and scalable business model that probably will solve exactly these issues that I just addressed. And I think I'll cut through this one here quickly. And there's many other innovation methodologies. Some of them I actually shown when I was at BMSC College in Bangalore. But the ones that I believe are the most important ones are the ones that just highlight is that EXO canvas, this value proposition canvas, is the one in the middle and bottom. The one on the left side is a business model canvas and what we call the blue ocean model. And then the design thinking process that we and the bio design process from Stanford that we then integrate into this Launchpad approach that is also part of the book that I presented you. So you can actually find some ways of actually using these type of tools. So again, I mentioned this already too: exploration phase, evaluation phase, impact generation phase. Most of the time, what we do in the university setup is that we focus on exploration, maybe a little bit on the evaluation. The goal of the exploration phase is that we actually have hypotheses set up and we try to actually validate or find out whether these hypotheses are true to a certain extent. And subsequently, we evaluate some solution ideas that we have. So it's a little bit that what you see in the lean engineering approach or design thinking approach, but with a feedback system of how far you've actually made it. So this is the total setup on this Purpose Launchpad Health model. There's different types of tools and canvases that we use. For the purpose, we use something called the Massive Transformative Purpose Canvas and the Moonshot Vision Mission Value Canvas. I don't want to individually go through them, all part of this book. And what I like about this methodology is it uses existing canvases, combines them together, and for each one of these segments, it gives you a feedback system. What we can do when you talk to me, for example, with your project, and I go through your analysis, I would go and put on a web server, I can actually click on and say, well, your purpose has not been defined yet. I think you have actually done a really good job on your purpose, on other things. And for each one of these segments, there's a questionnaire. And when you put this together, you can then create what we see here on the top left side, a radar. Where are we standing? Where is my project right now with respect to purpose? Is it still in the exploration phase, in the yellow phase? Is it already in the validation phase, or is it already in the impact generation phase? And you see here with this number 1 and number 2, those are issues where you clearly see, oh, I think I need to do a little bit more on the customer side to understanding the customer. I need to do a little bit more on the sustainability side. And what then happens when you talk to mentors like me, or maybe Abhishek wants to do that at some point in time too, is that we give you a to-do list of things that you can do to actually improve that part. And that's very, very important because now you have a feedback system for your innovation. And then hopefully at some point in time, you will make it so you fill it up and you feel really comfortable yourself with moving an innovation forward and maybe even doing a startup on this one. Okay, so last 2 slides. What I want you guys to do is to think a little bit more, also from an innovation perspective, is in terms of second order thinking. Think a little forward, what would happen when you do that, when you do something very disruptive. What does that mean in a month? What does it mean in half a year, in a year, maybe in 10 years? What does that mean? What changes in the environment? Think very, very big. Don't think small. Small steps will give you small improvements. Small improvements will take a long time till they're big improvements. Big improvements have a higher risk of failure, but when they're succeeding, they're awesome. So think exponential. And think about also, that's what we call the Medici effect. Think in terms of how do you actually create something that we call intersectional creativity? Put people together that are thinking differently from each other. They come from different sectors, because only if you do that, you will come up with ideas that are really big, great, and maybe very stimulating. Okay, some books that I would recommend in that respect, and the middle top row is one of my books. Sorry, a little bit of an advertisement. The bottom left one, Disruption. I think I actually have it right here. No, I have the Medici effect right here. But those are, this Disruptive Disruption is one of my favorite books. It's really, really great reading. But this Medici effect as well, it's really it's outside the camera. It's really a cool book that stimulates your thinking process. Yeah, with that, I'm done. I hope it was somewhat entertaining, and I still hope that we have some questions available. And this is the book I just sent you, so I hope it helps you a little bit in your innovation generation approach in the future. You can also buy it on Amazon, and that would be really cool if you do that too. And also cool if you put some review on there and how superbly you found this book. Always helpful. Thank you very much.
Thank you, Professor. It was wonderful. A lot of insights and new terms for our students, I would say. So questions by any of our students? So we still have 5-10 minutes. So do ask questions.
I mean, you have the opportunity, right? And it's always maybe a little bit of an info. If you don't have any questions, the lecturer usually is pissed, you know. So me. Nobody has any questions? Are they actually there? Maybe we have to make everybody turn their cameras on too. That would be something, huh?
I mean, post-COVID students have become very shy. It's very tough to get them. Yeah, Vani, you unmuted.
Yes, sir. I have a question. So in what way can we...
Do me a favor, sorry to interrupt you. Do me a favor, put the video on so at least I see who I'm talking to.
Yes, sir. Just give me a second. Yes, sir. So very good evening. Hello. So I just wanted to know in what way can we reach out to our communities to find out what exactly they need? Because usually there's a huge gap between what we think they need and what they actually do. So yeah.
Absolutely. I mean, very good question, because that's typically a question that I ask. I said, so how do we find out about innovation opportunities? And one of the things you can do is obviously throw out a hypothesis. So let me start maybe saying one sentence before. What engineers love to do, me too, is to build things. And then we go out and see, does anybody need that? Now that's the wrong approach. The right approach is to actually find out what the problem is and dive deeply into the problem and then try to build something that works with that. So there's something called, I'm put this in the chat because I think it's a really cool saying. You need to find a painkiller for a burning problem. But what people very often do, so sorry, there's a spello in there, but what people very often do from an engineering perspective, they have this painkiller developed, but unfortunately it doesn't solve anybody's problem. So what I'm trying to say is you need to get to understand the burning problem, then develop something that fits. So now to answer your question, if you asked the doctor what the doctor wants to have, what do you think what do you think you will get as an answer? So let's stick with my problem with the MRI. So you have a radiologist who has an MRI. What do you think he wants to have, or she?
He probably wants something that makes his job easier or something that might maximize profit for him.
Correct, a better MRI, right?
Yes.
So a better MRI typically costs more money. What do you think the radiographer who operates the machine wants? Good question. What do you think the patient wants? So if you have to go to the radiologist, what do you want?
My comfort, my privacy would be the priority.
Yeah, but you would like to have a proper diagnosis, right? A fast diagnosis. You would like to have maybe a system that does not look like a coffin where you're pushed in. And at the end of the day, you don't care whether it's a 1.5 Tesla or 3 Tesla. You just want the information to be proper at the end of the day. What do you think the health insurance wants if you have one?
They want to maximize their profits, of course.
No, the health insurance wants to minimize the cost. Now, at the end of the day, that means that they will have more profit. But do you already see there's money involved? And do you already see that there's 5 people that I ask you, or 5 potential, they all have different ideas. So what I do believe is, yes, you need to ask people, and you need to, but the most important thing is that you need to understand how they work. You need to go there, experience it, learn from it, and then maybe make your own assumptions that you subsequently try to validate. But asking people is a very difficult and a very dangerous thing to do, because you typically get the answer that you already know and that you already expect. Again, the radiologist wants to have a faster MRI and a better MRI. Well, I knew that before. I didn't have to ask him, right? But this is not where disruption comes from. That's incremental innovation. So try to go out there and learn yourself. And this is probably the best way to do it. And then actually think about, I'm going to give you the goal right now. So you have an MRI system, just to stay with that, because it's the easy example, which costs 1 million euros. I don't have a clue how many rupees that is, but it costs 1 million euros. And I just tell you, Vani, make an MRI that costs only 100,000, 10 times less. Go for it. Because if 10 times less MRI, that would mean 10 times more people could possibly buy it. That also would mean that 10 times the cost per scan would probably go down by 10 times, which would mean that many more people could actually afford one. Think that through, and think also through in what do you think right now is cumbersome and awkward, but people have accepted it, right? And then see on whether you can make that significantly cheaper and maybe significantly more efficient. This is also a way of looking at innovation, not always what you can do new, but how can you actually make something that is out there significantly better? And that one you can see. Yeah. So that's an idea, but there's many more ideas, right?
Yes, sir. Thank you.
Chinmaya.
Hi, sir. Hello. Yeah.
You have an IEEE. You have an IEEE sign in the back, or what is this?
Yeah, it's an IEEE sign.
Oh, here we go. Good.
Yeah. So, sir, I was thinking one thing. There are certain diseases which affect only a small set of people in the world, such as rare diseases, which are known as rare diseases.
Mm-hmm.
So, how do we go about innovating or treating such diseases or diagnosing them at the same time, keeping, say, a business model sustainable?
Also a very good question. And do you know how many countries are on this planet? Any idea?
So 192.
I think it's over 200, but you're very close. So how many different healthcare systems are there?
On the same as the number of countries that exist.
Absolutely correct. What I'm trying to say with that is there's no general answer for that. It needs to depend a little bit on the system. But if I would answer to you from a global perspective, there is no business model for rare diseases. Absolutely agreed. Yeah. So the question is, who do you believe should pitch in if there's no business model? The community, maybe the government, the health insurance.
The community,
for example, the community via taxes, via government activities. So I do believe that everybody has the right to live, and everybody has the right to live healthy, and everybody has the right to be treated. And whether you're one of these 1% cases or 0.5% cases, I think that we need to have global efforts to actually address these rare diseases. But that will not happen in India or in Germany. That may only happen if we have some global activities behind that. So maybe we need to talk to the World Health Organization or to some other more global organizations. And I think that's the only way to get it done. Or rich private people. Sorry, my dog is actually doing some weird noises here. So like there's the Bill and Melinda Gates Foundation. They are addressing these kind of issues with private money. So this is maybe a solution, but other than that, I would totally agree. It is difficult. Now I give you one more thing that I'm trying to find the book. I have too many books in my, oh, right here. By the way, a very recommendable book. It's from somebody you would not expect, actually writes Tony Robbins, Life Force. Tony Robbins is known for like motivational stuff. Oh, you know, he makes like, but he wrote this book together with Peter Diamandis and Robert Harini, some well-known guys. And it's a very thick book, but it's incredibly stimulating because they're talking about CAR T cells therapies, about genetic therapies. I believe that these costs for these individual treatments will go down significantly in the next years, and they will be able to address rare diseases. And I think there's a lot of research going into this. So very recommendable, by the way, this book. It's not very expensive, but it's really good reading.
Yeah, thank you so much, sir. Yeah, that answers my question. Thank you.
Thank you very much, Jim. Anybody else? Come on, guys. Needs to be at least 3 questions.
Okay, last one maybe from someone.
Did Abhishek tell you that everybody who asks a question gets a special point and a special treatment in the grading system? Did you say that beforehand?
Yeah, I can include that.
Maybe that stimulates.
Okay, looks like we don't have any more questions.
Right.
But
no more questions. No more questions. It is what it is. All right.
Yeah. So you can get connected with Professor Friebe on LinkedIn. He has already posted his LinkedIn handle so that you can go and you ask him anything, the next minute you'll have the answer. That's
what I'll do it. Well, I'll do at the same time is I'm gonna prepare the PDF and I'm gonna drop this into the, so at least people who stay here have the opportunity to get it. And I will drop this into the chat and you can download it. So the presentation is then available to whoever stays till the end, right? So let me just try to find it right here. And send. Okay, let's wait till it's sent and then we are done, right? So, and in the meantime, if anybody has a question, you can still ask.
Yeah.
Okay, so you should have it now.
Yes, it has come. I have one question related to my students compared to students in Europe or your university. So is there any big difference you're observing for your students versus, before COVID and after COVID? Are you seeing any major difference? Because I am seeing that.
Yeah, I do that too. But there's always, we have to be honest, there's always generational issues. Abhishek, you're not that old either. I'm a different generation. But what I have seen is that there is much more. First of all, they don't take it as serious anymore. The second thing is the work attitude has been reduced. The amount of interaction has been reduced. And so it's a little frustrating, I have to say. And it's also very difficult to find people for projects because the first thing they ask is, how difficult is it? And so that work-life balance issue is really a big problem. And so most of the times I cannot say how difficult the project is anyway. If it would be not difficult, I would have done it probably already anyway. So I don't know these answers. And it definitely, I definitely have seen a difference in the attitude and in the work ethics. So it is unfortunate that it has gone down, but I have to have a little bit of respect for that too, because it's a new generation and maybe they think differently and maybe they act differently. We have to accept that. We have to deal with it. I can also tell you, maybe that's something you wanted to ask but didn't dare to ask. I see even more differences with my with my German students than with my foreign students. So the foreign students, and there's a lot of Indians that I have as students, and a lot of Chinese and Pakistanis and also other places, they are still very active and very eager. And I see even a more dramatic reduction in that by the German students. They seem to be like, give it to me, but me working on it, difficult. So I don't know if that's the same thing that you feel.
Yeah.
What is your...
I echo exactly the same what you said. It's been very difficult to catch hold of. You put a lot of efforts and things like that, but end of it, you'll see students are not responding. Maybe they are understanding, but they are not responding. That's something which is little bothering for all our faculty members. We do a lot of discussions in department meetings.
Maybe I should say this from my perspective, and dear students, just so you understand that, I am doing this, for example, because Abhishek asked me to do that. He's not paying me for it. I'm doing this free, right? So I invest time in it. And what I do in Germany, I didn't dare to do this. I will not give a lecture if I don't see the videos. That's one thing. So I would never give an online lecture to anyone if I don't see their faces, because I believe it's respect to whoever presents. And I think that the appreciation of whoever talks is also indicated by the questions and the interactions. And so I'm just saying that to you all. You can take it or not, but please be empathetic and understand how people on the other end thinking. So if you don't get the appreciation from the students who are doing this for free, and you're basically spending time on it, you know what the next step would be? I'm not doing it anymore.
Yeah.
That's to your disadvantage, and it saves my time, to be really honest. I get my salary anyway. So it is maybe something we have to address more often, and because whenever I say I understand the students or try to understand the students should also try to understand the professors.
Yeah.
Any comments on the students? No?
I guess at least they can show some emojis and some faces to us.
Yeah.
Putting those efforts. It shows that they're still there intact with us.
Yeah. Well,
emoji to motivate others to put something. Are you guys there?
Yeah, maybe they're playing around with their cell phone. That's Jimaya does something.
Yeah, thank you for that. Ashwati. Okay, at least few of them responded. It means that they are here and they are with us. Okay, that's good. Okay, somebody's putting on chat. Okay, that's good. Thank you all. Looks like there are interested students who respect our thoughts and our efforts. Yeah, thank you. So let's wind up. Thanks a lot, Professor Friebe. I mean, there were little hiccups. I had scheduled last week your session, but we had...
it was not a problem at all.
Had to push it here. So thanks a lot for making time and giving us amazing insight about a lot of innovative way of thinking, and also giving some examples that really, I was inspired. Every time I hear you, it's not first time I'm hearing you, maybe 10th time, but I still get something new out of your talks. So thanks for that, for your efforts, and we'll catch up later. And thank you, students, for who have attended punctually. And no thanks to people who didn't respond, who didn't attend punctually.
Okay, yeah. And I come gladly back down to Bangalore. So let me just know, so.
Yeah. Okay. Thank you all. And then bye.
Okay. Have a good one. Bye, Abhishek.